my name is Amy Stokowski, and I am an RN at the Saddleback Medical Center, and I'm here to give you an overview and demonstration of how to use the Hillrom Intensive Care Unit bed. We're going to start at the head of the bed. Generally, you will find the bed in the most upright position and flat after housekeeping is finished cleaning it. At the top of the bed, you'll find some controls to bring the bed down to a patient level that they'll be able to get in and out of the bed at. The down will bring the entire bed down, and the up will bring the entire bed up. We're going to bring this bed down just a little bit to show you how it works. Okay. Also at the head of the bed, you'll find a little pattern marked with the number of degrees at which the head of the bed will go up. Usually in the intensive care unit, we like to keep our head of bed at 30 degrees so that patients will not develop pneumonia. Sometimes we may need them at 45 or 60 as well, depending on what kind of issues that patient may have while they're here. We're going to move down now to the main control panel of the bed. This is where you will find your head of bed and foot of bed controls. This top button is going to move the head of the bed up or down. The bottom will move the knees of the bed up or down. We're going to put this head of the bed right now to 30 degrees. So you would push and hold and watch the silver ball in that top part of your bed until it gets to the 30-degree mark. And there it is. Your silver ball is at 30 degrees. Now we're going to put the knees of the bed up just a little to show you that it does move. Again, press and hold. Sometimes you may have a patient that's a little bit too tall for the bed. Should you find this happening to you, there is a way to make these beds more accommodating. Right here you have a lock button. The light is off, which means that you are locked. If you push the button, the light will turn green. If you'd like to move the foot of the bed out, you have controls here for the feet. Pushing this foot, which points away from the bed, will lengthen the bottom of the bed. So you would push and hold. This one is actually already at its maximum. So if you would like to bring it in, push the opposite foot that goes in towards the bed, and that will bring the foot of the bed back in. Notice the foot of the bed coming back in.
Okay. Can you motion it out again? Excellent.
Some of the other controls that we find here, in case there's an emergency situation in the room, the patient begins to code, there's a red lever at the bottom of the bed that you can step on, and it will flatten the bed out and bring it to a level that you may be able to perform CPR at. We're going to do this, and it drops very quickly. You would step on this red button here, labeled with the CPR, press and hold, and the bed flattens out. It also instaflates at that time, so you have a little bit of pressure behind the patient's back. While the bed is also in a flat position, there's more options in which to move the bed. You may have to put a patient in Trendelenburg position to help their blood pressure rise, in which case, again, you will hit the unlock buttons to light the green light. Trendelenburg position is which the head of the bed is down and the feet are up. So right now we're going to press and hold that. And notice the foot of the bed coming up and the head of the bed going down. Again, if you want to bring the patient's bed back into a neutral position, key light you would have to press and hold, and then there is a button to push to make the bed flat again. This button also brings the bed into a lower position. There's also a reverse Trendelenburg. Again, push and hold the key, and hold the key in which the foot of the bed is low and the head of the bed is up. This is good for your post-cardiac catheterization patients that may have to eat dinner in a flat position. We also have similar controls on the inside of the bed in case the patient would like to position themselves and they are permitted to do so by a doctor's order. We can lock the inside panel so that patients are unable to move their head of bed or foot of bed should that become necessary. But the controls are relatively the same. Head of bed, arrows go up and down, foot of the bed, up and down. These keys we generally do not use, and our nurse call lights do not function on these beds because we have some attached to the walls. But head of the bed up, this will bring the head of the bed up. And foot of the bed, and they'll both go down. You can push and hold them both at the same time if you need it to flatten out more quickly. Right now I'm just going to flatten out the bed again so we're in our starting position. Which brings us to our next point. There's an electronic panel on every one of these beds that have various options in which to perform functions like scales, rotation, and sometimes even percussion. The most common one that we use is in fact the scale. The Hill-Rom beds right here have the panel built right in. In order to activate the panel, you lift it up until the light comes on. Hit enter. And here's your first home screen. Before we weigh patients, we have to zero the bed.
Can I just see it a second?
Sure.
Here we go. So that's our home screen?
That is our home screen.
Okay.
So first we need to zero the bed. And our protocol to zeroing patient beds is that we leave one pillow and the linens that the housekeeper leaves on there on the bed, and that the bed is in the flat position. So I'm actually going to remove one pillow for the sake of accuracy. We go to our home screen. We go down to main menu. Hit enter. Scale functions is your top button. You're going to hit enter for that, and it will bring you to this scale screen. Arrow down to the 0 scale. Press enter and release the panel. And make sure nobody is touching the bed until the scale says scale is zeroed. At that point, you can go ahead and weigh your patient. Again, on the screen, you will lift the panel, and generally once it's zeroed, it goes straight to the weigh patient button. Hit enter there. Again, let go of the screen, make sure nobody or anything else is touching the bed that you do not want to be included in the weight, and it will beep when the patient is weighed. And it does display the date, the time, and the last date and time in which this patient was weighed, as well as the weight in kilograms. Once you've weighed them and this is the correct weight that you would like to keep, there is an accept button that pops up below the weight. You hit enter, and that's your new weight for the patient. And you may go back and check the weights just by going to the weight screen. It will pop up again, the date, the time, and the last kilograms.
Okay. Very good. Also, this bed has the rotation.
I mentioned it, but we need modules.
Okay, and you put those modules in, and then you're able to use that function.
Ours don't work, though.
Okay. All
The
right.
last part of the Hill-Rom bed is going to be the cardiac chair position. This is great for the post-cardiac surgery patients that can't quite get out of bed yet, or anybody that really can't get out of bed but needs to be sitting. Again, you're going to go to your home screen here, push the key button to unlock, and there's actually a panel on the bed that has a chair position. So once you've unlocked the pad, push and hold the chair position. And it does take a minute for the bed to function.
Bed's coming down now.
The bed is going down first, and then it's going to proceed into the chair position. Except that this one isn't. There we go. And the foot of the bed will drop, so be sure to remove any equipment that you had at the base of the bed. You just continue to hold the button until the bed stops itself. it doesn't have to be all the way in the complete upright position either. You can stop at any point. But for the full chair position, you would hold until the bed does stop.
Okay.
And that is essentially the chair position.
It's wonderful for patients who are unable to ambulate to a
Who's
chair
that bar
yet.
here at the bottom?
This bar at the bottom.
I think that's manual pump.
Yeah, I was going to say, I think this one brings it up, but those don't usually work
Work.
on our beds. So.
Okay, and let's just go to the swivel to lock and unlock.
Okay.
Let's start
the
there.
The last part.
Mm-hmm.
The last part of the hill-around bed is actually how to move the bed around. Right here you have a lock and an unlock. Orange is locked, which means the wheels are locked and you cannot move the bed. Green means unlocked and you're able to move the bed. There is a trick. When you move the bed, you actually want to put it in a neutral position. So you would push on the green button until you're balanced in the middle. And it will beep at you if you're in the cardiac chair position.
Okay.
If you push the green button all the way down, you can still move the bed, but it's much more difficult to steer, so we don't recommend you try that option.
Okay.
So we're going to put this one back in. We're just going to push the bed over to the side, and it's fairly easy to move with one person if you just need to move around the room. And then once it's in the position that you'd like it to be in, again, you would lock the wheels so that nobody gets hurt getting in and out of bed. So just push down, and the beeping will stop.
Okay. All right. Thank you, Amy. This was wonderful. This was an excellent presentation.